Welcome.
Yeah, I guess we can get started. Thank you everyone for joining us this evening to talk about oral health in Connecticut. My name's Callie. I'm one of the interns at COHI. And I'm joined by Sandra. I'll let her introduce herself.
Hi, everyone. My name is Sandra Ferreira Molina. I'm the Policy and Advocacy Director at the Connecticut Oral Health Initiative. Thank you so much for being on with us. And thank you to Kelly for presenting.
So before we get started, we do have translation services available, so Sandra will be translating. If you can just go to the right side bottom corner of your Zoom and choose if you'll be listening in English or Spanish. Even if you don't need translation services and you're listening in English, please choose that so that you can continue to hear me. And I'll give everyone a second. Okay. So tonight we'll be diving into Connecticut's oral health policy landscape, particularly wins from the 2025 legislative session, our next steps at COHI, and how you can get involved in advocating for better oral health in Connecticut. So before we dive into the content, we're just going to open up a poll about your understanding, um, just to get a little temperature check on where everybody is. Okay. And it looks like it launched all 4 questions. If you could just focus on the first 2.
Kortuma haskili duruyor ne? Vale. Tamam.
Okay, thank you for participating in our poll. And now we can get into the content. Sandra, if you want to go to the next slide. Okay, so let's talk a little bit about why we're here, and who COHI is and what we do. So COHI, which is short for Connecticut Oral Health Initiative, is a nonprofit that was founded in the early 2000s to strengthen and safeguard access to quality, affordable oral health services for all Connecticut residents. COHI was originally founded as an outgrowth of the Connecticut State Dental Association Committee, and it has been supported by many other dental and medical organizations over the years. But currently, COHI is the only nonprofit in Connecticut that focuses solely on advocating for improved oral health. So on the screen, you'll see a list of COHI's priority agenda, from adult Medicaid expansion to opposing change in Connecticut's Medicaid model. We'll drop a link in the chat now if you would like to explore all of these priorities further.
We
And
have a
Sandra,
few people that just joined.
okay,
And so I just wanted to make sure that if you need interpretation from English to Spanish, go to the bottom right hand to the globe and choose Spanish. Si usted necesita interpretación en español, por favor vaya al globo que está a la mano derecha abajo de su pantalla y escoja español. Thank you, Callan.
thank you. Then we can go to the next slide whenever.
Oops.
Okay, so here are some of the wins from this legislative session. We saw significant progress for oral health in Connecticut across multiple fronts, including the prioritization of oral health in the state budget, workforce development, advancing oral health equity, and Medicaid investment. So now we'll walk through these wins and what they mean for Connecticut residents. And we can continue. One really critical win for oral health was protecting community water fluoridation. Water fluoridation is really important. It's one of the best ways to improve oral health through strengthening enamel, reversing oral decay, and preventing cavities. It's also cost saving, as every dollar spent on fluoridation as a preventative measure saves $38 in dental treatment costs. So I'll drop a link in the chat for this as well if you'd like to learn more about the importance of water fluoridation. And as of the 2025 legislative session, it was codified into law under Senate Bill 1326 that Connecticut systems serving over 20,000 people must fluoridate their water at 0.7 milligrams per liter plus or minus 0.15, which is in line with current federal regulations, but it also protects Connecticut water systems if there's any fluctuations in federal fluoridation laws. And we can go to the next slide. Another big win was workforce expansion for oral health. A declining oral health workforce, including 20 dental health professional shortage areas in Connecticut, really highlights the need for oral health workforce expansion. Senate Bill 1450 was one critical piece of legislation passed in this session to promote workforce expansion, and it enacts a loan reimbursement program, which provides grants to full-time healthcare workers in Connecticut. Another key win within this legislation is that 20% or more grants will go to those in rural communities and federally qualified health centers, which are often areas with severe oral health workforce shortages. Sections 440, let's just go back. You're okay. Sections 447 and 448 of House Bill 7287, which is also known as the budget, also remove licensing fees for out-of-state and foreign-trained dental professionals, removing an additional barrier and incentivizing new dental professionals to practice in Connecticut. Furthermore, the budget also included a substantial Medicaid boost for community health centers in Connecticut, with a combined state and federal Medicaid expansion by $15 million in fiscal year 2026, $36 million in fiscal year 2027, and $80 million in fiscal year 2028. And we don't know specifically what that looks like for oral health yet, but it is promising that community health centers are receiving this additional support. So advancing equity was another big win for oral health in this session. One such bill is House Bill 6442, Section 9, which requires a Commissioner of Veterans Affairs to conduct an evaluation of the provision of dental services to veterans in the state and identify areas of improvement, which is really critical, as we know that some populations have specific health needs. Some more pieces of legislation that advanced equity this session in oral health were part of the budget. HB 7287, Section 201 specifically requires the state's correction ombuds to evaluate the provision of healthcare services to people who are incarcerated, and it must include medical, dental, and mental health care and substance use disorder treatment services. And Section 282 of the budget changes the language from inmates to incarcerated individuals, shifting more towards dignified language. So here are just some of the missed opportunities. So Senate Bill 1299, which is one that COHI supported, did not pass. It would have expanded adult Medicaid to include 2 annual exams and cleanings, treatment for periodontal disease. It would have removed preventative care and medically necessary services such as dentures from the $1,000 annual cap. And overall, this would have improved access to care and especially targeted periodontal disease, which over 45% of adults experience, but it's not currently covered by Medicaid/Husky. Another missed opportunity was a medical loss ratio and insurance reform. Dental loss ratios would have ensured that a greater portion of premiums directly benefited patients, improving access to essential care and promoting better oral health outcomes. 7 bills were introduced related to dental loss ratios or dentist and insurance negotiations, but none passed, and over 20 states already have them. And protecting vulnerable populations was another big missed opportunity. as Husky coverage is under pressure right now, especially with federal Medicaid cuts. So some of the federal Medicaid cuts recently could impact oral health and health in Connecticut. So Congress has already enacted Medicaid cuts, slashing billions in federal support to states, jeopardizing access to coverage and essential services. And mandatory work requirements and tighter eligibility rules threaten eligibility status for those on Medicaid. Here's a list of co-sponsors that we had for Senate Bill 1299. So as you can see, it was supported, and this is something that we could look back at. So some of our next steps at COHI are to strengthen relationships with policymakers, shape future budget proposals, and prepare for a robust 2026 legislative session. And there are ways that you can be involved as well. So some ways you can advocate are by sharing your story. You can get in contact with local representatives or advocacy organizations like COHI, learning about oral health in your state. Staying up to date on policies and systems that impact oral health makes you better prepared to spread the word and support what you care about. And also volunteering and supporting grassroots initiatives. So I will drop another link in the chat now about how you can get involved in COHI, with COHI. Here are some of our upcoming events. So we have an advocacy happy hour coming up on Thursday, August 7th. And we can share this out as well. And we also have forums for Husky. Many of them are targeted towards specific communities and populations. But at these forums, if you have any experience with Husky currently or previously, you can come and share your experience. And that information will be used to help advocate. Okay.
Oh, can you show that again?
Of course.
Can you show all those meetings again, please?
And these are just a tentative schedule. But if you see any that you're interested in, and we can also share the information and the flyers about this once it is finalized.
Lynn, if you'd like, we can email this to you. We can email the presentation out if you would like. Okay. All right, well, I'm going to stop sharing my screen. Does anyone have any questions that you would like to ask us? So as Callie mentioned, we are doing several community forums across the state, and they're really important because it allows us to talk to the community, talk to you, so that we understand what is happening with your access to dental care, both if you've been enrolled in Medicaid and or well, we know Husky is Medicaid. And so if you're currently or have been enrolled, we want to know good and the bad. And so if you know anyone, as Callie mentioned, and I also mentioned, we are going to send out our schedule so that we have your participation. This information is compiled and a report is put together, which is then shared with all of the legislators in the state of Connecticut. And it also helps the Connecticut Oral Health Initiative create our policy agenda based on what is happening in the community. And so it is extremely important, if you're able to help us, send out the information. So does anybody have any questions? And I know we have a few people just joining us, but obviously you registered for the webinar. We will be sending out the slides so that you have the information, and we will also be sending out the calendar, the information with the flyers of our upcoming forums. Yes, go ahead. Did someone want to say something? Well, if I would actually like to ask something, and I know that we did this in the poll in the beginning of the webinar, but if you're able to react to this question, did you know that Husky is Medicaid? You can come off mute and let us know. We have a quiet group. But that's okay, because the idea of this webinar was to inform you of oral health policies here in the state of Connecticut. Oral health is overall health, and it is up to us, people in the community, to make sure that we advocate for equitable access to oral health. And so I am not going to have, oh, yes. Thank you, Beverly. Correct. Yes. Medicaid is Husky. And that is really important to know because of all the federal changes that will be occurring. And so it is very important for us to talk to people in our community and tell them about and tell them that if they're on Husky, they too could potentially see changes in their coverage, including different redeterminations and work requirements. And so we will work very hard to make sure that we send out information to all of you so that you know what is happening at the state level. And as I mentioned, I am not going to have the last word. Callie, I will let you close us out.
Thank you, Sandra. And thank you everyone for joining this evening. We finished pretty early, so I'll give you your time back. But thank you again, and I've dropped all the links in the chat if you'd like to learn more about COHI, but you can reach out to any of us as well if you have any questions, thoughts, or concerns about oral health in Connecticut. Thank you.
Thank you, everyone.